The latest studies show us that people who have the surgical intervention versus those who don't experience the exact same outcomes.
Wow.
Yeah. He said, but the people who have the surgery will experience more issues down the track.
Ladies and gentlemen, welcome to another Bulletproof for BJJ podcast. Have you got a sore knee? Have you got a meniscus problem? Have you had an aching knee and you don't know what's going on? A good friend of mine does. Joseph Worthington, please talk to me about your knee.
I love the way you open with that, talking to the peoples. Guys, if you don't have an aching knee, you should still listen to this because you're going to get one at some point.
Well, no.
It's going to happen.
I mean, if you don't have an aching knee,
you're not training enough.
Do you even do jiu-jitsu? Just give it 5 seconds.
All right, so where did we leave off on my last update?
Well, the thing is...
do I need to give a synopsis?
We've been chronicling this on the inner circle.
Right.
And so those behind the paywall understand what's going on. But it just in a little brief summation, it went from nothing to what?
All right, so had no issue with my knee ever. Woke up one day during the holidays, actually. Knee was a bit sore. That's odd. Knee's a bit sore. No big deal. Enjoyed the holidays for a couple more days. Went to jiu-jitsu shortly after. Came away from that session. My knee's definitely not quite right. Something's going on.
Worse?
That night, swollen, sore. Oh, man, there's something going on here. Got an MRI. Eventually, MRI showed existing tears in the meniscus and the cartilage, but they were old tears.
Okay.
Which I was not aware of because the knee had always felt great. Now, that's not a hugely odd thing, right? If you train jiu-jitsu and you put a microscope on your knees, you're probably going to find some shit.
Wear and tear.
But there was a small little extension tear on one of those old ones. It's pretty cool that they can see that too, right? They'll be like, these tears are old, but this little bit here, this couple of millimeters, that's new.
Wow.
So long story short, been doing some rehab since that time. Been doing some rehab for about 4 weeks. Booked in with a surgeon.
Hang on. You went and saw...
So I went and saw my guy, Justin Lang.
Right.
Justin Lang is the knee guy here in Sydney. He's in the Shire in Caringbah.
Is he a black belt now? Brown belt?
No, purple or brown. I don't know if I think he's the kind of guy, he's always sort of doing some grappling.
Sure.
But I don't know if he's engaging in the class kind of.
He's a jiu-jitsu guy.
Oh, yeah. And he's a handful.
Yes.
Athletic
guy.
Athletic. He's, this guy trains all of the athletes.
Yep.
Football play like rugby league, rugby union cats, AFL, they're all there. Anyone that's rehabbing their knee, like athletes, they go to him. He's Rob Whittaker's strength coach. Yep. He knows his shit. And he helped me a lot with my ACL reco many years ago. But I went to see him and he said, look, man, let's just get the swelling down and let's just give the knee what it needs for a little while and see if this thing can just return to normal without surgery. But he said it's worth going to see the surgeon to get his view on it. So I went to see the surgeon, was very lucky. I think Justin pulled some strings for me, got me in within like a couple of weeks. This surgeon, he's down that way as well. He's super busy. Mm-hmm. I called up and booked and they said, next available appointment's in like 3 months. So I took that and then they called me back and said, actually, we've had an opening for next Tuesday. I was like, I'll take it. But
Joey's outside the clinic, just like killing people. Yeah. You can't make this appointment, buddy.
Sorry, old lady. Hard for you to get your hip looked at when you're on the ground.
Boom, in the bush.
This episode is brought to you by Parry Athletics, the exclusive apparel sponsor of the Bulletproof for BJJ podcast. We've been working with these guys for quite some time now. We absolutely love the company. We love their gear, both for training and also just looking slick off the mats. They got excellent no-gi wears, shorts, t-shirts, all that cool stuff. If you want to get yourself into some Parry clothes or you want to rock the Bulletproof for BJJ exclusive merch, you got to go through Parry, go to parryathletics.com and use the code Bulletproof20 to get 20% off your order. They ship internationally. So I went in there and look, I had the results from my MRI showed that there was no flap of meniscus or anything like that would be getting stuck in the joint.
Good sign.
But what I've been experiencing day to day is this catching sensation. It's kind of shit because sometimes you're walking around normally and then all of a sudden you just get this catch and you're like, oh, and then you're like hobbling and then your knee's sore and then you're like, And so I'm using like Voltaren gel in it to keep the swelling down. I'm like, I'm not doing jiu-jitsu. I can't squat. Like it's affected things pretty significantly. I was doing some work on the ladder the other day at the house and like just getting up and down the ladder. I'm like, God damn, I look like my dad right now, who's had double knee replacement. Anyway.
Tough.
So I'm thinking, all right, cool. Yeah, there's probably something floating around in there. They're probably going to want to do an arthroscopy, which is like keyhole surgery where they go in, clean the shit out. And of course, like I put this shit out on social media, bunch of people messaging in, friends and followers of Bulletproof, whatnot, saying, oh man, like one friend, Diego, shout out, was like, bro, I had that, went and got the clean out. I was good in like 14 days, best thing I ever did. I'm like, okay, sick. Like this would be awesome. And when you get that clean out, that arthroscopy, it's very short recovery because the only trauma is them cutting your skin.
Yeah.
Right. They're not drilling shit, whatever. So I'm thinking that's the go. Went in, saw the surgeon. He brought the MRI up, showed me the MRI. Really cool. Was the first surgeon, doctor person of that cloth who could actually show me the MRI and talk me through to show me what I'm looking at.
Nice.
Yeah, which I find often they'll bring it up on the screen, but they're kind of moving so quick. You're like, I can't decipher what this image is showing me.
Yeah.
But he's like, see that? That's fluid. See that? That's your cartilage. See that? That's your meniscus. This is the healthy side. And he's like, this is where the issue is. And he goes to it. I'm like, okay, I can see the issue. So he said, there's definitely a flap here that's getting caught in the joint.
Right.
And that's the pain you're experiencing. He said 5 years ago, I would have said, yeah, let's go in there and shave that off and then you're good. But he said, the studies show us now that that's not the best approach. He said, you're at 6 weeks. I'm going to suggest you just leave it. He said 6 to 12 months, it'll probably take care of itself.
Wow.
He said the latest studies show us that people who have the surgical intervention versus those who don't experience the exact same outcomes.
Wow.
Yeah. He said, but the people who have the surgery will experience more issues down the track because you're going to get a bit of arthritis and shit because you've now lost that bit of meniscus. He said, but yeah, really, there's no difference in the two approaches.
So a surgeon advised you not to get surgery.
Isn't that refreshing?
That's wild, people. I think that's the first time I've ever heard that.
Yeah, he said, you're at 6 weeks. He said, that's really early. And that was interesting. He's like, this is really early. Like this is still the acute phase. He said something like this will usually resolve itself within 6 to 12 months. But he said probably at 3 month mark, you'll be feeling very differently about it. Right. And he said, look, come back and see me in 3 months. Let's book it in. Here's a referral for an MRI for another one. And he said, but you don't have to come. You can cancel that appointment if you want. And the MRI is free because he's like, when I refer it, it's covered by our medical system.
Amazing.
Incredible. But he's like, yeah, I think you'll feel very differently about it another 6 weeks from now. Wow. And I was like, man, that's amazing. And I'm like, so what, like, what do you
do now?
Yeah. I'm like, so I said, wait, clarify this for me. I said, so you're saying like, I'm in pain right now, right? But you're saying if you do the surgery that the outcome for me is going to be the same. So is that just a case that the pain comes at a different time? Like I got pain now, you do the surgery, I feel good. But if I do the surgery
further down the track,
and he said, actually, no, he said, that's what I thought when when this science first started coming out. But he said, no, it's all just the same. Like you just stay in pain and your knee's sore. And he's like, it's not, and I guess that goes into like this new pain science, which is like your pain is often not always like it was originally connected to the physical thing,
the damage,
but it remains even after the physical damage is gone.
See, this is so interesting to me because I'll just sidestep slightly. When I almost completely tore my hamstring off the bone, a physio had said to me, I went back in 6 months after the fact and it had healed. And I'm like, I'm still getting pain. It's still kind of tight. And the physio said, well, how's your range of motion? I said, oh, no, range of motion is good. It's like, no, that's just your nervous system. Like, because you were in pain for an extended period of time, it's kind of hardwired. Like you might get pain there in 10 years' time. You might get have I done it again? He's like, no, that's just a little, not a spasm, but it's a little like
a muscle, like a memory kind
like
of
a little
thing.
message, yeah, that's in there. but it doesn't mean that that area is still damaged. It's almost like a hangover, an echo of that. And I was like, whoa.
It's wild, eh?
Yeah, but maybe that's protective. It's
Yeah.
like your body saying, hey, man,
Don't forget.
Don't do that shit again.
Yeah.
Wow.
And so I said to him, like, well, I'm guessing like for the next couple months, like no jiu-jitsu. And he said, I think you can do what you want just as long as it's not aggravating it. So he said, just go, get back into things. And if your knee blows up a bit, then okay, don't do that.
Just takedowns.
But that's right.
Yeah. No spider
Just calf slices, saddle shootouts, 50-50 shootouts.
Aoki escapes.
Let's just go 100% from south. 3, 2, 1, go.
Just go get movement in there.
So I was really blown away by that. And the other thing he said, I thought this was kind of fascinating. He said, what I would suggest is that you get on the bike. Bike's always good for knee stuff. And he said, the bike's really good because you're just flexing and extending the knee for reps. And he said, and over time, the hope is that your bones would just grind that little flap off.
Oh,
They just shear it off.
Oh.
And he's like, and that's all we're doing in the surgery anyway. So if we give it time, your body would hopefully do that by itself. And he said, what a lot of my patients have reported is that they have a catching moment that's like quite painful for a second, and then the knee is good. And he's like, usually it's just sheared it off, and that's like, and then you're like, oh, feels good, and then that's it.
Wow.
And I was like, wow, dude, that's dope.
This is intriguing. I've never heard any chat like this before.
Yeah, isn't it? It's new shit. I mean, I just know that. Sorry, my telephone.
Joe's Twitter is blowing up right now.
It's Gordon Ryan. I just listened to that last episode. What the I know that, even the surgeon that I saw who did my ACL, and I think he was great in many ways, but I can just picture that he would have been like, yeah, we can get in there and clean that up. And, because it's like, I don't know.
That's the paradigm of the time, right? That's what was taught. But then even like Tim Travail posted the thing about debunking the myth that, like the ACL, like you were talked about before, like the fixed leg rehab. Where
the bracing protocol.
Yeah, he posted about how that proves that, like, because it was the old paradigm was, well, you can't
ligaments won't repair themselves.
No, they won't reattach.
Yeah.
But this proves that they can.
Yeah.
And do.
Yeah.
Not everyone, but it can work that way.
Yeah. I've had that situation a couple of times recently where I've come to training with some water, but I haven't had any electrolytes, and I've finished training and I've had to go to a convenience shop and buy myself some kind of sports drink, usually a Gatorade. Cost me like $7. It's small and it really doesn't contain that much of the good stuff that I'm looking for, which are the electrolytes. Sodi, on the other hand, is my partner when it comes to hydration, and I'd simply just run out of it. And it sucks because I got to go buy expensive stuff that doesn't do anywhere near as good a job. I'm super stoked that we've been restocked with the Sodi, and now I can be properly hydrated when I train jiu-jitsu. This has always been an underexplored aspect of my training, and I'm so stoked that we now have these guys in place to support us and also the listeners of the show. So if you want to be hydrated on the mats so that you can perform at your best and have the best mental clarity while training, get yourself some Sodi. Go to sodi.com.au. That's SODII.com.au. Get yourself some delicious hydration salts and use the code bulletproof15 for 15% off. Go to sodi.com.au, get yourself hydrated.
It's awesome.
So yeah, I was so stoked with that, and I was like, mate, you're a legend. And I was like, what, like, because I'm still using like the anti-inflammatory gel and stuff. And he said, yeah, just use that stuff. Like if you need it, keep using it. If it gets real bad, take the tablet ones, whatever. He's like, manage the pain, but give it time.
Right. He didn't advocate for injecting growth hormone straight into your knee?
I was like peptides. No, but I figure I'll do a bit of my own research.
Okay.
Hey, Gordon, what do I need for this?
What's best for hulking knee recovery? Well, that's awesome. And I think that can actually give hope to a bunch of people out there who might be in a similar situation, not necessarily same, but meniscus is one of those troublesome things for most people where it's like, if you've torn your meniscus, it's kind of like surgery in the past has felt inevitable, relevant to that.
Yeah. And I definitely, you know,
thought that.
yeah, I was like, I told you, I'm like, I think it's going to be surgery, bro. Because, yeah, you feel like it's this physical thing that's just not going to change. You're like, it doesn't, like, you know, as we know, like meniscus doesn't really have blood flow. So your body can't change them. They're just, you get given meniscuses and that's it.
Yeah.
And so once you tear it, it's torn. So you're like, I think they're going to have to, you know, surgical intervention. But no, they're like, well, there's an intervention of sorts, but it's administered by your own body.
Right.
And shave that shit off.
It takes longer too, right?
Yeah.
So,
and I tell you, instantly, I came in this morning to train and I had a really good training session. It was an upper body session, mind you. But just because the surgeon had been like, no, you're good, give it time, don't worry about it kind of thing, I was like, all right, let's just get on with it.
Took the pressure off.
Whereas in the last 4 weeks, I've just been like, it's all a bit of a drag, like hobbling into the gym and the training sessions, or, I'm doing rehab stuff. I'm like, oh, this sucks. But it's amazing how just that conversation changed my outlook.
Well, you learn, right? He actually was able to, it wasn't just that it wasn't just good advice. It was literally, here's the problem, here's how we view it, and here's how you should approach it. Like that.
Yeah.
That's very clear, well-educated advice. So, yeah, that would definitely help eliminate the being in purgatory. Like, what do we do about this? You know, you know now.
Yeah.
So that's cool.
But I'm thinking, even if he'd have said like, yeah, we need to do surgery and let's book it in for 2 months, I probably would have stayed in a bit of a funk.
Right.
You know, because I got a knee that needs surgery, man. My knee's kind of narrative.
Yes.
Versus now I'm like, well, my knee's injured, but it's going to get better. And it's just a waiting game. So, you know, like there's a real, there's a feeling of optimism there.
Yeah, that's so good. I think that's really positive, man. Well, stoked to hear it.
Thanks.
And what is the ETA now? Is it just a matter of how it feels?
Yeah, it's just time, you know. So look, I think like for someone listening that might be having a similar sort of experience, you know, 6 to 12 months, it's a long period of time. If you're just into jiu-jitsu and it's like, you might, you know, take a few months off, maybe you have to take 6 months off, right? Maybe your tear is bigger than mine and there's a bigger flap and it's quite painful. And like that, you know, it's still a real kick in the nuts in that way. It's not so much for me because I'm not that obsessed about jiu-jitsu anymore.
Yes.
That I'm like, well, whatever, I can take a year off.
Yeah, well, maybe it's just you just have a more balanced approach anyway.
Yeah, but if it had been a blue belt or something, you know, like when I was at like peak froth,
yes,
would have been like these are my best years, man.
Wrecked your life, yeah.
In a way, so you know, so I think that's, you know, also something you have to take into account. But yeah, like largely, I'm like, cool, great, part of the process. Let's learn some new shit.
That's positive, man. Glad to hear it.
Thanks, dog.
Now, my friends, if you would like to share information like this with your jiu-jitsu friends, the easiest way you can do it is to like, follow, and subscribe. That's all you got to do. It's just a couple of seconds, beep, bop, boop. And that means other good people like you get to see it, hear it, and they can share it too. Also, if you're listening on an audio platform, give us a 5-star rating. We love it. Appreciate y'all. Peace.